Another first, another horrible first. For the first time since the COVID-19 pandemic began, more than 4,000 people in the United States died from the disease in a single day, according to Johns Hopkins University. To be as exact as possible, the latest tally as of this report says that yesterday, Thursday, 4,051 people died from COVID-19. Again, by the time you see this, that number may have changed, but it won't be for the better. The researchers and scientists at Johns Hopkins, who, by the way, have been doing such a great job throughout this pandemic tracking the misery it has caused, but by the time you see this report, those researchers may have discovered even more died yesterday than originally thought. But 4,051. We'll never know who exactly that one is, but it's a human being, we know that. It is somebody's mother or father or sister or brother or best friend. It was somebody alive, and now that person is dead because of COVID. We can't let hundreds of thousands of people who have died from COVID become statistics. Nobody knows that more than infection preventionists and other healthcare professionals on the front lines battling this coronavirus. Because of the contagious nature of the disease, the people who die often die without loved ones around them. The last people to hold their hands and talk to them are the nurses and others who care for them at the hospitals. We here at Infection Control Today have a great editorial advisory board. They've been way out in front on just what challenges COVID presents. For instance, they've been saying for almost a year now that the thing that worries them a lot is the number of people who have COVID-19 but are asymptomatic. Well, yesterday, Thursday, the U.S. Centers for Disease Control and Prevention, the CDC, came out with a study that says that nearly 60% of COVID-19 transmissions come from asymptomatic carriers, more than half. The CDC researchers reached that conclusion by examining data in 8 studies done in China that show that 59% of those who catch COVID catch it from people who have no symptoms. The CDC study is published in JAMA Network. Hi, I'm Frank Diamond. I'm the managing editor of Infection Control Today. We want to give infection preventionists and other healthcare professionals on the front lines the information that they need to better battle COVID. Let's step back for the bigger picture. In the United States, there have been over 21 million confirmed cases of COVID-19. And in the United States, about 365,000 people have died from COVID-19. In the world, there have been over 88 million confirmed cases of COVID-19. And in the world, nearly 2 million people have died from COVID-19. These stats, again, brought to you by Johns Hopkins University. According to the COVID Tracking Project, more than 132,000 people are hospitalized because of COVID, the highest number since the pandemic began. The number of hospitalizations more than doubled since mid-November. Okay, the COVID-19 vaccines, they're here, but have they arrived? The rollout has been slow. Only about 30% of the 17 million doses of the vaccines have been administered. Most of the doses have been meant for healthcare workers on the front lines in hospitals. But as the number of hospitalizations that I just quoted suggests, the hospitals are swamped trying to care for COVID patients. Who has time to launch a vaccine effort that could be somewhat tricky? People can't just meet in the cafeteria and line up. Also, many of the vaccines have been sent to long-term care facilities, but the rollout isn't going too well there either. According to the CDC, just 13% of the approximately 3,300,000 doses of COVID vaccines distributed to long-term care facilities have been administered. Dr. Anthony Fauci of the White House Coronavirus Task Force tells Axios that those are bumps and hiccups that, in Fauci's words, won't last long. The way Fauci sees it, the problem of vaccine distribution and administration is because of a lack of a coordinated effort by the states and the federal government. He expects that change will come when President-elect Joe Biden takes office. Fauci expects us to get to some sort of normal life again by the fall. But the hard truth might be this: COVID-19 is always going to be with us. That's the opinion of Dr. Kavanagh. Dr. Kavanagh is a member of Infection Control Today's editorial advisory board. Now, that doesn't mean we can't get our normal lives back. As Fauci points out, we can. If enough people get vaccinated and the vaccines work against the new strains of COVID that have been cropping up, and they should work, says Dr. Kavanagh. But in the words of Dr. Kavanagh, we're never going to eradicate COVID-19 from the face of the earth, the way we did with smallpox, knock wood. For one thing, animals can catch it, but we can coexist with the disease, and Dr. Kavanagh tells us how. That's my interview with Dr. Kavanagh, and that's coming right up. For these and other stories, please go to infectioncontroltoday.com. When the new COVID-19 vaccines came out, everybody wondered, what now? And almost as if to answer that question, I mean, just like that, not too long after that rollout of the vaccines came a new strain of COVID-19, one that scientists thought might be 70% more infectious than a strain we've been battling for months now, and that's upended our whole world. Then Dr. Kevin Kavanagh told readers of Infection Control Today that the vaccine should be able to work against this new COVID strain. Hi, I'm Frank Diamond, the managing editor of Infection Control Today, and Dr. Kavanagh joins me. Dr. Kavanagh is a frequent contributor to both our print publication and our website. He also visits us a lot on these broadcasts. Dr. Kavanagh is going to talk to us today about COVID mutations in general and how the medical world will deal with them. Dr. Kavanagh, thanks for joining us today.
Well, thank you very much, Frank.
So the appearance of that new strain, it got many people thinking about exactly what we might have to fear from these mutations. What are your thoughts on that?
Well, I think it was because it was timed with the vaccine that people started to pay attention to these mutations. But actually, these mutations have been going on since March. And I wish at that time people had said, hey, we need to slow down the spread of this virus and really observe social distancing, wearing masks, and obeying public health advice. You need to remember that the first mutation of significance was probably the D614G mutation, which came to the United States from Europe, and that's the prevalent strain, and it is also thought to be more infectious. So this mutation just ratchets up the infectivity of this virus, which is, of course, a major concern. The more people that get infected, the more people that will potentially die or become disabled from this disease. However, currently there's no indication that the disease that it produces is more severe. The jury is still out on whether or not it can avoid vaccines, but from looking at the science, that is a tall order for the virus to do, and it probably will not do that at this point.
I thought it was interesting that you just use who might die or become disabled from COVID-19. I know this is a little bit off track about what we're going to do with mutations, but can you go into a little bit more about what you think might be disabilities that would result from COVID-19?
Well, one of the things that's really frustrated me with this epidemic and pandemic is that people are totally focused on dying. In other words, who is going to have a fatality or a fatal result. But in actuality, the disabilities are much, much more concerning because that is even affecting the young people, and it can be chronically disabling to people. Not saying that death isn't a terrible factor or a terrible outcome, but the disability can be long-term. You've heard the terms long haulers. And people that are hospitalized oftentimes are discharged with chronic lung, chronic kidney, and chronic heart disease. As you know, I've written an article in Infectious Control Today that advocated that in many ways, COVID-19 is a heart and lung virus because it can have asymptomatic myocarditis, which can present decades later as a cardiac myopathy. So this is, to me, very concerning. And as with any disease, as we learn more and more about it, and less people die, those individuals that escape death are often severely sick and have chronic, long-lasting effects of this disease. So we really do need to also focus on that. In other words, what is the true toll on our society?
How many mutations could this possibly could we possibly see with SARS-CoV-2?
Well, Frank, there's literally been thousands of mutations with this virus. If you go to nextstrain.org, you can see them plotted over time and over distance and location. But only the mutations which affect either infectivity or affect the spike protein, which causes attachment of this virus to the ACE2 enzyme, those are the ones which are important and the ones which are discussed in the media and tend to be tracked. So this is an RNA virus. It mutates quite a bit. We shouldn't be surprised at that, but the important mutations are ones of concern and they need to be followed. Now, I should add that infectivity is a lot easier for the virus to mutate than to mutate away from a vaccine. Because as you know, a vaccine causes a myriad of antibodies to be formed to that spike protein. And a virus would have to evade every single one of them to be successful. And that's a tall order because in that evasion, the virus also still needs to maintain the ability of that spike protein to attach to the ACE2 inhibitor. Otherwise, it trades survival from the vaccine for loss of being able to infect and reproduce itself with the cell. This is kind of the situation we see with the measles virus, where it does a lot of mutations, but it can't mutate out of the vaccine's coverage because if it does, it can't become infectious. Now, as far as for monoclonal antibodies or monoclonal cocktails, where you just have a small number of different types of antibodies, that the virus could evade. And there are some strains now, one which I believe was detected in Scotland and Romania, which has been able to mutate and evade, for example, a single monoclonal antibody. But that's different than invading the whole vaccine. Of course, it's still possible, and if it does happen, that will be a grave concern. Luckily, with the new types of vaccines we have, they're kind of printed out in a lab. They're not cultured, they're not grown. You type in the sequence of that new spike protein, and out comes an mRNA, which can be inserted into the vaccine. So it really is revolutionary, and it adds to safety. That would take 4 to 6 weeks to do, but nevertheless, the big problem is, how do you revaccinate the entire world? So we need to slow down the spread of the virus so we slow down its mutations. That is of utmost importance. Well, I think that they have to be able to articulate this and to message this to the public, to give this as another reason why they shouldn't be out and about and gathering. You have to remember, Frank, it's not the vaccines which prevent disease, it's vaccinations. And we don't have enough vaccinations that have been performed. And so they need to do that. And they also need to remember that if they do see something strange, or they do see a spike in cases, or they see people that are developing reinfections, they need to culture that virus and get it genetically sequenced. Contact the local health department. I'm sure they'll be able to have instructions on how to do that. And certainly the state and CDC would be interested, because you want to make sure that a spike in reinfections is not being caused by a viral mutant. And so that's going to be of utmost importance, and that's something they need to be looking out for. Nevertheless, the chances are the mutation will evade the vaccine. Yeah, they'll be effective. That's what the good money is on. Can't guarantee it, but certainly that is the likelihood and what is expected to happen. But that doesn't mean we should keep spreading around the virus, because eventually the virus may find a combination that can both maintain its attachment to the ACE2 receptor plus evade the vaccine. It's just not good to do. This is another reason why this whole philosophy of herd immunity is just rubbish and magical thinking. We're going to have to learn to live with the virus. We've talked about this before. We're not going to have everybody taking the vaccine. And the virus is already set up in the animal population of multiple species. So it is unlikely that we're going to totally eliminate the virus. I think getting a vaccine may become a yearly or every other year type of a ritual that we're going to have to start to undertake. Well, herd immunity is where there are enough infected individuals that will stop the spread of the virus. And the percentage will depend upon the number of people which are infected, or the percentage will depend upon the infectivity of the virus. So the more infectious the virus is, the more people that need to be immune. The problem is if you have animal hosts, if your immunity drops, and it will over a couple of years, they'll just reinfect you. You won't be able to truly wipe out the virus. So it's not a good strategy of getting over this. We really do need to learn to live with the virus. Things will get much better, but I don't think we're going to be able to eliminate this virus off the face of the earth, similar to what we did with smallpox. And the reason for that is it has an animal host. So the idea of going out, getting infected, and the virus will go away, nah, that's not going to happen. It'll get better. Infections will drop dramatically. We can return to a more normal life. But I think right now it's going to be pretty much endemic, either in animals or in ourselves, and that we'll see it reoccurring in spots or in areas. And if we all let down our guard and let down our ability to fight off the virus by not getting vaccinations, we may go through this again a decade from now. So we do need to follow public health advice, and we really need to get vaccinated at this point, especially if you're a frontline worker and it's not if, but when you'll come down with COVID-19.
Have you ever seen anything analogous to this? I mean, I guess nobody's ever seen anything like COVID-19 in their lifetime, but what exactly is happening here? It sounds like, in the way you're describing, something like the measles, way it reacts, but then also something like the flu, which comes back every year in a different form. So what kind of analogy can make us understand how this thing interacts with human beings?
Well, it's going to be kind of like the flu in that it can mutate and come back, although maybe not mutate quite as fast as the flu. It's unlike the flu in that it affects every organ of the body. And I think it's the people that are asymptomatic that have the primary heart and vascular involvement. Although it's asymptomatic, it still can be affecting those organs. And as you know, they account for up to 50% of the transmissions. And so in that way, it's very different. So we've really never seen anything quite like this. And I believe it's definitely more deadlier than the flu that was back in 1918. There's two reasons for this. One, the 1918 flu had a tremendous amount of bacterial co-infections, up to 90% in the lungs of individuals. And at that time, medicine couldn't treat that. So that resulted in a large excess mortality. And the other thing is that when you look at the infectivity of the virus, the 1918 virus was probably more infective, but it wasn't because of the characteristics of the virus. It was because of the characteristics and behavior of the human population. At that time, we were in World War I. There was an initial outbreak, I believe it was in Kansas at one of the barracks. And from there, it just spread. And you talk about packing people into trains, into ships, into training camps, on the front lines and trenches. It just spread the virus like wildfire. And so that you had a huge amount of spiking in cases along with fatalities which occurred. And this occurred worldwide because it was a world war. And so, yes, you may see more actual fatalities in total from the 1918 flu, but that doesn't mean that virus was more deadly, because we were involved at a time of a world war which was optimizing the transmission of that virus throughout our population. And remember that fatalities from a pandemic is equal to both the case fatality rate, but also the transmission of the virus. And that is a function of both the infectivity of the virus and the behavior of the population it's infecting. So I know that's kind of a long answer, but this virus is entirely new, although it does have some similarities to some other viruses and other infections, which allow us to predict what's going to happen.
Stories of people who are famous, either famous in the political world or journalism world, movies, entertainment, sports world, also in medicine, who have not, especially the ones in medicine, who have not practiced, but they've they preach, and they're caught, violating the rules that they're trying to hand out to everybody else. So I guess I'm asking for a visceral reaction. What's your visceral reaction to that? I guess a little bit of frustration, or
massive amounts of frustration, because that creates doubt in the public as to the validity of their advice. And this has been happening, as you know, fairly commonly. You have a number of leaders which are not preaching the message which they are following. But there are also many leaders which are on both sides of the aisle. You can look at Governor Baker, Governor Hogan, Senator Mitch McConnell, Senator Bill Frist, all of which are preaching the correct public health messaging of wearing masks, social distancing. Senator Bill Frist from Tennessee recently called upon both his governor and all governors to enact mask mandates during this terrible crisis that we're currently undergoing for these few weeks. So I do think that the messaging is a problem. We need to keep people on track. And I'll be honest with you, the thing that bothers me more than anything is that it seems like some of our leaders who have voiced so much that this virus is not much to worry about, don't wear masks, seem to be at the front of the line to get the vaccine. And so that also is something which really gets me. I kind of on the opinion, and I hate to say this on record, but if you haven't been following public health advice, you should get a vaccine, of course, but maybe you should let others to be front in line, because you're responsible for creating the predicament which we're in. And so that is another area that I think is very frustrating.
Now you're a man of medicine. You're a scientist, and it was funny what you just said. But isn't that the crux of the situation? Human nature. Isn't that what, in a way, we're up against here? The human nature that we want to see other people, and we think the risk is something that other people are going to take. It's not going to hurt us.
Oh yeah, it's all human nature, but it drives the public crazy.
Yeah.
But this virus doesn't care. The best example that I know of is what happened at the Louisville Zoo with the snow leopards. I think I mentioned this in my article. The snow leopards, they're very good at enforcing physical distancing, not so good at wearing masks, and they caught COVID. So you have to do both. The virus doesn't care. If you congregate, you give it a chance, it's going to spread. Your best defense right now is following public health advice. And when the vaccine's available, please get the vaccine.
Okay. And finally, just to circle back around to mutations that might come up with this COVID-19 and my readers, infection preventionists, any final words of advice for them?
Well, just that, reassure people at this point to get the vaccine. The vaccine will in all likelihood be effective, because again, it's very difficult for the virus to evade the myriad of antibodies that your body will produce to the spike protein, and at the same time maintain its infectivity and ability to attach to the receptor on the cell. So please message your patients not to panic, but to please be diligent and follow public health advice, because even a more infectious virus can cause more deaths and is more dangerous. But the good news is the vaccine still should work, as should social distancing and wearing masks, making you safer. So although this is not good news, it's not anything I feel to panic over, but it is something that should increase our diligence to follow public health advice.
Dr. Kevin Kavanagh, as always, a member of our editorial advisory board, contributor to our print publication and our website. As always, good to see you and a fascinating discussion.
Well, thank you very much.
Now back to you, Gina.
Excellent. Thank you. Let's turn things over to Psychiatric Times. Take it away.